the areas of fatty infiltration are near the portal vein, but not always. The most common areas of fatty infiltration are anterior to the gallbladder or near the portal vein. Really, hepatitis is any inflammation of the liver, but in general we recognize the word hepatitis with viral hepatitis, and we say hepatitis A or B or C, but hepatitis is any inflammation of the liver. Viral hepatitis are the typical hepatitis that we recognize when people say someone has hepatitis. The disease can cause any inflammation of the liver. Sometimes alcohol, drug toxicity, and other causes can produce inflammation of the liver that is the same that say hepatitis. But the most common for us and that we must know is the viral hepatitis, that is the result from infections for different virus that specifically target the hepatocyte cells. Type A hepatitis is the most benign of the hepatitis and is transmitted by contamination of food. In general, it's not very common in the United States, but it's very common in other worlds countries like Latin America, Africa, and even in Asiatic countries. But hepatitis A, that is the most benign, is not common in the United States. The hepatitis B, that is more dangerous than hepatitis A, but is not as dangerous as hepatitis C, is transmitted by bloodstream. Some people also say that by sex can be transmitted hepatitis B. It's a more serious disease than hepatitis A. Sometimes go chronic, but it's not as dangerous as hepatitis C. Hepatitis B has a vacuum. Hepatitis B is a big risk for healthcare workers, and this is for that all the people working in hospitals must be vaccinated against hepatitis B. The acute hepatitis is when the hepatitis is so big and the damage of the liver is so strong that the person is going to die by a massive necrosis or dying of the liver cells. It's a big liver failure. Ultrasound is really the best device to diagnose liver hepatitis or viral liver hepatitis. There are other laboratory examinations better than ultrasound. You can find sometimes hepatosplenomegaly, not always. Sometimes the gallbladder wall is thickened, but in general are not very easy to diagnose hepatitis only with ultrasound. This is a hepatitis with a gallbladder wall thickness, but this is not the common. A lot of hepatitis have nothing that you can see in ultrasound. The diagnosis of hepatitis is with the laboratory examinations. Chronic hepatitis. Chronic hepatitis is when there are inflammation of the liver more than 3 to 6 months. What are the causes of chronic hepatitis? The principal viral, sometimes metabolic, other time autoimmune. That is that the person produces antibodies against the liver, and other time drug induced, but the most important for us is the viral cause of chronic hepatitis. There are two chronic hepatitis. Chronic persistent hepatitis is benign. It's a self-limiting process, but chronic active hepatitis not, and usually progress to cirrhosis, liver failure, or even cancer of the liver. Cirrhosis of the liver is the change of the normal cells of the liver, the hepatocyte, by fibrous cells, and also called scar tissue. The liver, when there are cirrhosis, is not more liver, it's only scar tissue, and this is the change that produces cirrhosis. The essential feature is parenchymal necrosis, regeneration, and fibrosis. Fibrosis is the final of the liver, and this is called cirrhosis, when the liver is fibrous tissue. No hepatocytes are there. No hepatocytes, no liver function can be accomplished. This is a microphotography of the liver cirrhosis. A lot of fat, a lot of fibrous tissue. Other picture with fibrotic nodules inside the liver, and other picture with the yellow fatty fibrous nodules inside the parenchyma of a cirrhotic liver. Cirrhosis is a chronic process with liver cell failure and portal hypertension. Portal hypertension produces increase of the pressure in the portal vein, and the increase of the pressure in the portal vein produces ascites, or that is the same, free fluid in the peritoneal cavity. In general, cirrhosis most common cause is alcoholic abuse, but not the only one. Sometimes nutritional deprivation or hepatitis can produce cirrhosis. Different type of cirrhosis: biliary, fatty cirrhosis, that is the most common, and post-hepatic cirrhosis. Biliary cirrhosis, the bile ducts are obstructed, that leads to inflammation, fibrosis, and regenerative nodules, that is the most important characteristic of liver cirrhosis. Fatty cirrhosis in general is the alcoholic cirrhosis, not the only, but in general the beginning of the